Since we're on the topic of hip thrusting, might as well keep it there. We're going to take it to a pulley this time, okay? We're also going to have the setting low and also the force pulling from behind, okay? So it's also going to really help with the hip hinge too that we kind of alluded to in other videos. So what I did was I took the ropes, okay, and I kind of just put the setting all the way down. Of course, before you start with this one, start lighter, be a little more conservative with the weight, and then gradually progress from there. So what I'm going to do is I'm going to face away, okay? I'm going to go ahead and work on mechanics. Don't let the patient just bend like this, okay? Go ahead and start to build more good habits. Okay, make sure you bump your butt like I just did. So I'm going to go ahead and grab here. All right, I'm somewhat in a hip hinge position already. And what I want to do is go ahead and stand tall and then walk, okay? So walk until you feel that tension build up. You should feel like you're kind of falling forward just slightly. What you're going to do is arms are going to stay straight. You can even retract the shoulder blades if you want, because the arms are not going to be involved in this, okay? They're just going to be holding the ropes. What we're going to do is allow the weight to slowly pull us into that hip hinge. All right, so we're going to hip flexion. All right, until you feel that stretch in the hamstrings. That's your cue to start to really tense the glutes and come into hip extension. So I'm here, again, shoulders straight back. I'm not pulling with the arms, you're just holding it. I'm going to complete the motion with my hips, okay? So I'm hip thrusting. And I keep emphasizing not pulling with the arms, because a lot of times patients, or people in general, will go ahead and do this. So if you see the hands bleeding, that's a no-no. That's going to be more of an anterior shoulder exercise. So make sure we emphasize that the hands are just there to hold it, and that we're really completing the motion with our glutes, okay? As we said, they're a powerful hip extensor. We're also getting a little bit of eccentric load on the hamstrings, because we have the hamstring glute complex, okay? Good squeeze, and as they're done, safety, walk back slowly, put it down. If you perform this one yourself, you're gonna feel your glutes at the very end of the motion. It's gonna be a very powerful one. And we have someone in the stands.
What kind of foot placement should we have for this?
Aha, good point. So, I like to do kind of just parallel to each other, okay? Just really, we kind of go for like almost like a squat position. Okay, when you're squatting, you're not going to be in a stagger stance unless you're doing lunge. That's not a squat. We're not going to be too close, okay? Because obviously then you can't get the ropes between. So again, I like to assume that squat position. Alrighty, as we're getting into hip hinge, about shoulder width apart.
Do we want toes flared out or parallel?
You can have toes slightly parallel out, because if you do, you're going to get those external rotators and that glute a little more engaged as we go ahead and get that external rotation. So you can, but not excessively either, okay? Because then it's just going to kind of evolve it, and the knees are going to be a little off. So a slight turn out to get those external rotators working a little bit, and it's really help assist finishing the motion forward. All good points. I'm glad Sean mentioned that, because that is really, really important. So again, foot positioning, how far we come out. Again, not utilizing the arms, just holding it. Use all that, and you have a powerful exercise. Try about 2 to 3 sets of 10. Again, squeezing for about a second or two to really build that tension, make sure you're controlling the motion. And if you do all that, you're in good hands. Give it a shot.